Disclaimer. This video content is AI generated as educational purposes only and is not a substitute for professional medical advice, diagnosis or treatment. Your health concerns may be unique. Always consult your physician or a qualified healthcare provider for personalized guidance.
All right, today we're diving into something pretty wild, a complex and kind of hidden medical condition. We're talking about a dangerous tangle of blood vessels that can just form silently right inside the brain. So let's jump right in and figure out what this is and why it's so incredibly important to understand. Okay, think about the blood vessels in your brain for a second. It's this super intricate network, right? Kind of like electrical wiring. So what happens if that wiring gets all jumbled up, tangled, and starts to short circuit? Well, that's a pretty good way to think about a condition called a brain arteriovenous malformation, or you'll hear it called a BAVM. So what is this thing, really? At its core, a BAVM is this messed up, tangled connection that goes straight from the high-pressure arteries to the low-pressure veins. And here's the crucial part. It completely bypasses the middleman. It's missing the capillary network. You know, that super delicate web of tiny vessels that's supposed to slow the blood down and deliver all the good stuff like oxygen to your brain tissue. Without that buffer, what you're left with is basically a ticking time bomb, a fragile, high-pressure system that's just way more likely to rupture. And that's a perfect lead-in to our first big topic, really understanding the risk here. Why are these tangles such a massive concern for doctors and, of course, for patients? So, yeah, the million-dollar question. Why is this tangle so dangerous? It all comes down to pressure, just immense, relentless pressure pushing on vessel walls that were never, ever designed to handle it. And this brings us to a really important number. Every single year, a BAVM that hasn't ruptured has about a 2 to 4% chance of bleeding inside the brain. Now, you might hear 2 to 4% and think, that's not so high. But here's the kicker. That risk is cumulative. It stacks up year after year after year. And if a rupture does happen, well, the consequences are incredibly serious. We're talking about a hemorrhagic stroke, permanent neurological damage, seizures. It's a grim list. And get this, for people under the age of 50, BAVMs are actually the #1 cause of brain hemorrhage. The outcome can be absolutely devastating, which is exactly why finding and dealing with these things is just so critical. Okay, so before you can even think about treating one of these, doctors need a map. They have to see what they're up against. This whole diagnostic phase, it's like a high-tech detective story. Specialists use some seriously advanced tech to peek inside the brain and chart out every single twist and turn of this crazy maze. Neuroradiologists have this amazing toolkit for mapping these tangles. The gold standard, the best of the best, is something called a cerebral angiogram. They actually inject a special dye and can watch in real time a live-action roadmap of the blood vessels. It's incredible. Then you have things like CT and MR angiography, which give them these super detailed 3D images so they can see exactly where the AVM is and what it's touching in the brain. And this really hammers home a key point. No two BAVMs are alike, not even close. Every single one is unique. Different size, different shape, different location. So all this super detailed mapping, it's not just about figuring out, yep, it's there. It is the absolute foundation for cooking up the safest, most effective treatment plan for that specific person. All right, so the map is made. What's next? A whole team of experts, neurosurgeons, neuroradiologists, gets together and looks at 3 main ways to tackle the problem. And a lot of the time, they actually use a combination of these. So let's break down these options. First up, you've got microsurgical resection. This is, open brain surgery. They go in, clip it, and take the AVM right out. For AVMs they can get to easily, this is an immediate cure, with a success rate over 95%. Wow. Then there's stereotactic radiosurgery. This one's non-invasive, no scalpels. Instead, they use these super focused beams of radiation to damage the AVM's blood vessels. It's great for smaller AVMs or ones that are buried deep in the brain. The catch? It works slowly, taking 1 to 3 years to fully close off. And the third path is endovascular embolization. This is where they thread a tiny catheter all the way up to the AVM and inject a special kind of glue to block the arteries feeding it. This one is often used as a helper to kind of shrink the AVM down and make it easier to deal with using surgery or radiation later. Okay, so those are the standard plays. But what do you do with the really, really tough cases? The ones where none of those options are safe or just won't work? Well, this challenge has sparked a major innovation, a whole new way forward for the most difficult tangles out there. See, the problem with some of these complex AVMs is that the arteries feeding them are just impossible to get to. They're too small, too twisted, too far away. So, clinicians did something brilliant. They completely flipped the script. Instead of trying to fight their way in through the high-pressure arteries, they found a new path, going in backwards through the low-pressure veins. It's called transvenous embolization, or TVE for short.
And it's not just a cool idea. A major review of studies in 2022 basically said, hey, this new therapy is showing some seriously incredible promise, especially for the AVMs that, in the past, doctors would have just called untreatable. That same analysis took a deep dive, pulling all the data from 7 key studies on this new technique, and it gave us our clearest picture yet of just how well it works. The results are in, so let's check out the numbers.
First up, the big one, the cure rate. Get this, TVE was able to completely shut down the AVM right then and there in an astounding 93% of cases. That is an absolute game changer, an instant cure for patients who, before this, might not have had any options at all.
Okay, but what does that mean for the patient's life afterward? Well, almost 91% of patients had what's called a good functional outcome, and that just means they were able to get back to their lives with very little or even no disability. That's huge.
Now, of course, no brain procedure comes with zero risk. We have to be realistic. The data showed a complication rate of about 10.5%. So this gives us a balanced picture. It shows that while this TVE approach is incredibly powerful, picking the right patient for the procedure is absolutely critical to keeping it safe. So everything we've talked about so far is, well, it's kind of like plumbing or electrical work, right? It's all mechanical. You're physically removing or blocking the AVM. But the next giant leap in this field isn't about fixing the tangle after it's there. It's about stopping it from ever forming in the first place. And for that, we have to go to the molecular frontier. Yeah, the whole way researchers are thinking about AVMs is shifting in a big way. They're moving past the question of, okay, how do we get this thing out? And they're asking something much more fundamental. Why does this tangle even form to begin with? It's a total shift toward understanding the deep biology of the disease itself.
And you know where they're finding the answers? In our genes. It turns out that specific mutations, and these aren't ones you inherit from your parents, they just happen in the cells lining the blood vessels, are the key drivers. We're talking about mutations in genes you might have heard of, like KRAS, BRAF, and PIK3CA. These are now seen as central to the whole process of how these tangles get started.
And that discovery has just blown the doors wide open for a whole new approach, precision medicine. So instead of surgery or radiation, the new idea is to use drugs that are specifically designed to target the broken pathways these mutations create. You've got MEK inhibitors for KRAS mutations, PI3K inhibitors for PIK3CA, and so on. This is truly personalized medicine, aimed right at the root cause of the problem. And all of this leads to the final, really exciting question. If we can really target the tiny molecular machines that actually build these things, could we one day have a pill that could stabilize them, or shrink them, or maybe, just maybe, prevent these dangerous tangles from ever even forming? That is the ultimate goal here. And that, right there, is the future of how we treat this incredibly complex condition.